Tips from the ER. Broken bones. For most people, having a broken bone should be excruciatingly obvious. It's one of the worst pains you should ever have to feel in your lifetime. But I say most people because I've seen some of you savage motherfuckers casually walk into the ER with a broken foot. For the rest of us, the first thing you're going to want to do with a broken bone is to hold it still. Depending on where it is, arms, legs, try to find something long and hard to wrap around it to keep it from shifting around too much. We're going to get you an x-ray, get you some pain meds, and then comes the fun part. We're going to push, pull, and press those crackly bones back together. Your bones are pretty strong, so it may take 2 to 3 of us. But once it's straightened out, we're going to make sure that fucker doesn't move around by putting one of our fancy immobilizers on it, aka a splint. No cast necessary at this time. Depending on how bad it is, like if it's completely shattered, or if it's sticking out of your skin like an iceberg out of water, you may need surgery, ASAP. If not, we're going to send you home and kindly ask you to hold fucking still for 6 to 8 weeks to let your bones properly heal. Tips from the ER. Stroke. If you all of a sudden have trouble seeing, speaking, walking, suddenly have the worst headache of your life, or all of a sudden have weakness on one side of your body, like your brain is telling your left arm to pick up that remote, but you can't pick up that remote even though you really want to pick up that remote, you could be having a stroke. In which case you're going to want to get your ass to the ER ASAP. A stroke happens when blood can't get to your brain. This is typically because a little rock in your body called a clot is stuck in your brain, blocking the blood flow. Luckily, the ER has a special medication called TPA that will break up this clot and unclog your brain. TPA is like Drano for your blood pipes, and it works just as well. We gotta get it in ya, and fast. Because if a part of your brain goes without blood for too long, it's gonna die, which means parts of your body will be paralyzed. Forever. Tips from the ER. Motorcycle accidents. One of the most common traumas in the ER. We get them all the fucking time, and it's not hard to see why. Motorcycles offer absolutely no protection during a motor vehicle accident. Best case scenario, you break a couple bones. Second best, you die. Because the worst case scenario, in my humble opinion, is that you suffer a traumatic brain injury, leaving you paralyzed and your poor mother as the only person willing to wipe your ass after you shit all over your bed. But hey, at least you look good in a motorcycle jacket. Just try not to hit anything on the freeway. Some of you even like to knock back a couple drinks before you ride. Daredeviling motherfuckers, aren't you? Even if you are wearing a helmet, flying off your bike at 70 miles per hour isn't exactly a recipe for survival. You'll probably die instantly. Best way not to get into a motorcycle accident, never get on a motorcycle. Tips from the ER. Seizures. Did you know a person can actually feel the moment right before they have a seizure? Oh yeah. They know it's coming, and there's nothing you, me, or anyone else can do to stop it. But what you motherfuckers can do is try to keep them safe. There are a couple types of seizures. Sometimes it's just a blank stare, like this. And sometimes it's a full body vibration that could include some kicking, swinging, and shaking. If that's the case, they're gonna fall to the ground. So catch them, motherfuckers, or they're gonna crack their head open. Once they're on the ground, clear everything around them so they don't hit anything, and protect their head. Don't let their face grind on the ground like that. There's no need to hold their body down or keep them from shaking. Just let it happen. It's fine. Once things calm down, turn them to their side so they don't choke on their own spit and wait for them to wake up. They're likely going to be super confused and not remember anything. So let them know they've just waken up in the year 2025. I'm kidding. Don't fuck with them assholes. Having a seizure isn't always an ER visit, but if you're unsure, tell Siri to call 911. Tips from the ER. You're drunk. If you're drunk and you get into a potentially life-threatening accident, but you have no health insurance, there's going to be very little you can fucking say or do to stop us from treating you. Even if you manage to say, I don't want your help, we're going to assume you can't safely speak for yourself because it has been determined that you are too intoxicated, motherfucker. You are now a danger to yourself and potentially others, and we can't have anyone dying on our conscience. Especially if you had a head injury. We got to get you a head CT. Make sure you're not bleeding under that skull of yours. I know you need to pee. You've had a lot to drink, but we got to get the scan first, so don't pee on yourself. Or you're going to be sitting in it. It's going to suck having to pay for a financially crippling medical bill along with your DUI, but hey, at least you won't be dead. Don't be mad at us, motherfuckers. We just want you to live! Tips from the ER. Bone marrow. Getting an IV when you come into the ER is pretty standard. We find a nice juicy vein, stick it with the needle, shove a straw through it, and voila! You now get life-saving drugs, so you don't have to die. Hooray! But sometimes getting an IV through your vein just isn't possible. And since time is of the essence, we're gonna move on to the next best thing. Your bone marrow. That's right, motherfuckers. We're gonna take a tiny little drill, shave a hole through your bone to get to your bone marrow so we can access your bloodstream. Hopefully you aren't awake for this. It's called an intraosseous access. Osseous for bone, intra for inside of, and access means you now get life-saving drugs, so you don't have to die. Hooray! Your bones are pretty fucking hard, so we're gonna have to use a nice big strong needle when we drill. Best part is, the needles are color-coded. Blue and yellow for adults, pink for the babies. Tips from the ER. Waiting. Some of your expectations of the ER are grossly inaccurate, so I'm gonna try to clarify some things. Being a patient in the ER sucks. Ask any ER worker and they'll tell you the only reason we'd ever check into the ER is if we're mutilated, bleeding out, or somehow wake up there. Besides that, we're gonna avoid that place because we know being a patient in the ER sucks. You're gonna be waiting. A lot. Mostly because your idea of an emergency will likely not be our idea of an emergency. The ER is like the redheaded stepchild of the healthcare system. We get everything that nobody else can or wants to deal with. Homeless, drunks, the uninsured. Every time you go to your healthcare provider with a problem and they go, nah, I'm not sure. Check into the ER. We get our dicks kicked in because they'd rather send you to us than have to deal with you. One more person who probably didn't need to come to the ER. Now you're in a waiting room full of patients asking why you have to wait so long to see a doctor. It's because people are actively dying. You should be happy you get to wait, motherfuckers. Some people never get that luxury back. Tips from the ER. Nosebleeds. There are a few reasons why you might be bleeding out of your smell holes. Either your nose is super dry, you just got hit in the face, or you forgot to cut your nails before you went digging. Your mama told you it was a disgusting habit. Now look at ya. More blood on you than a used maxi pad. The first thing you're gonna wanna do is pinch that nose shut, lean your head forward, and breathe through your mouth, like this. Hold that position, motherfuckers, for as long as you can. If you tilt your head back or lay down, you're gonna start drinking your own blood. Some of you sick fucks may be into it, but I promise you, your stomach is gonna disagree. A nosebleed isn't typically an ER visit, but if it's out of control, you can come by and we can blow a little balloon into your nose to keep the blood from escaping, or we can burn that nose shut. Whatever it takes to keep that blood inside your head. Tips from the ER. Dog bites. I know it's been a rough year for you. You've been sad and alone, and you thought getting a dog was gonna solve all your lonely problems. You brought that mutt home, gave it nothing but love and trust, and how did it repay you? By chomping you so hard, you'd question why you'd ever let a canine so close to you in the first place. You were drunk, weren't you, motherfuckers? Admit it! A dog's mouth is full of bacteria. That's good for them, bad for you. If you get bit by a dog, there's a chance that bacteria has infiltrated your body. You'll know because that dog-bitten area will soon become big and red, which means you're probably infected. Luckily, a quick trip to the ER for antibiotics will solve all your sad puppy problems. Here in California, we will have to report the pup that mauled you. It's not that we don't love him, it's just that if it does it again, we're gonna have to put him down. I'm just kidding, we wouldn't hurt him, we're just gonna turn that bitch in. As for your wound, we're gonna have to wash it out with saline. Get rid of that good doggy mouth bacteria before we patch you up and send you home. Rough. Tips from the ER. Fake seizures. Ah, yes. Usually a patient's last-ditch effort to keep themselves in the ER, likely because we just told them we are done with their treatment and now they get to go to jail. That's when they drop to the ground and flop like a fish. Get off the floor, Richard. The officers are waiting. But some of you won't even put in that effort. You'll just go limp. That's when we take your hand, put it over your head, and drop it. If it smacks you in the face, alright, we believe you. You're unconscious. But most of the time, your hand will magically fall to the side and avoid your face. That's when we know, you's a liar, motherfucker. With real seizures, you won't care what starts hitting you. To prevent injuries from real seizures in the ER, we have what's called seizure pads that we strap onto the side rails to keep you from breaking your face or bruising your shins. Every ER I've worked at, we can never find the seizure pads when we need them, so we end up wrapping the rails with blankets and taping it together. It's quite ghetto, but it gets the job done.